everybody.
Hi, everyone.
I'm Valerie.
And this is Sheila.
And we are today's Litches.
This is our show, Sandwich Generation.
That's right, because we've got parents above and children, grandchildren below. So here we are.
Here we are.
All right, so let's get started because we have kind of a, I would like to say fun packed.
No.
But I wouldn't say that because we're going to get into
some kind of
heavy senior health care. So that's not always a fun topic.
Yeah.
But let's see how interesting it'll become. That's for sure.
Absolutely.
Lots of controversy. But I think we need New news. Okay, so new news. Let's start off with Brittney Murphy Williams.
Yep.
She is an American entrepreneur. She was in the healthcare industry and lost her job. And so now she started her own online and she's marketing all by herself. And we thought we'd give her a shout out because we like to do that with up and coming people.
Yeah.
You know, something interesting. So she's developed, for you Americans, she has developed her own sanitizer, spray sanitizer. And yeah, and you can certainly.
It's FDA approved.
Right. She's on TikTok and you can certainly find her at Brittney Murphy Williams at yahoo.com. Right?
Yeah.
Anyway, we will put a
there. Obviously, as you can see, pretty different colors than what you're used to. But I thought that, you wouldn't want just a boring color. But the scent is amazing after you put it on your hands and it dries. I thought to give you guys the gel or the spray option. You guys can DM me on here. I can, if you're close by, I can come bring you the hand sanitizers. If you're not, I can ship them out and send you a receipt. People are paying me on Cash App and Venmo. There's a website that I use, but it does cost people a little fee to pay. So obviously I'm trying to make this as affordable as can be. So please help small business.
Oh, yes.
Big plug.
Big plug. Well, actually, not just a plug, a shout out. And we like to do this, especially because I think music is dear to our heart.
Yeah. Like everybody. Also helped us get through the pandemic too.
So we had a conversation with this wonderful guy today, and I'll let Sheila get started because
Will Canyon. He's out of Los Angeles, California, and he's a teacher, a musician, a musical teacher. He has a passion for playing music, has since he was a child. He's out of Canada, which is awesome.
Born in Nova Scotia.
Yeah, born in Nova Scotia. And so he's putting together some beginner classes.
Yes.
And like I said, he's got online learning that's going to be coming up as well. I know he's just in the middle of that. So yeah, I'm sure that's, like you said,
he's been recording and it's just around the corner and you can find him on Facebook.
Yeah, at Will Canyon.
Will Canyon. And we will definitely put in his information in the top right-hand corner, especially for you guys down in the USA. Well, actually, where it's online learning, it doesn't matter where you are.
That's what I'm thinking.
And truly a musician at heart.
Yep.
I would say he plays the piano, he plays the guitar, and I think you should all go... Harmonica, yes. You should all go check out his Facebook page and his very, very inspirational
music
videos that he puts out, and he lives in an amazing spot.
So you get to check out another part of the world too.
Exactly, and it's kind of always warm there. So we can, wish. But yeah, go check it out because he does some covers and he does some of his own music as well. Yeah. And definitely worth looking at. And again, He'll be in the
Yeah,
top
top
corner up here where my finger
will.
is once I get through editing all of this.
That's right.
So we wanted to give those shout outs and wanted to give a plug and for Brittney Murphy Williams. I keep wanting to say
Yahoo.com.
yes, and I keep wanting to say Williams Murphy. Sorry. And then of course Will Canyon.
Yes.
Awesome, guys. All right, so let's get started.
Let's get into the hot topic.
Hot topic.
Hot topic.
Canadian senior healthcare. Well, that's opening up.
That's a hot topic. Yay.
For sure.
Yeah.
Hi, Alex.
Hi, both of you.
Oh, Mom.
Yeah.
Hi.
So it's such a hot topic. And there's, again, a lot of ways to address this topic.
Yes.
But we had also, so let's start with what you were saying earlier about the.
Okay, you want to go there first?
Yeah, I want to go there first.
Please,
let's hit it.
Please don't hate me. These are
these are numbers.
Numbers. Right? These are stats.
People try to manipulate them, but these are numbers.
Yeah, they are numbers. So, I was reading, actually it's posted for anybody to go look at, that 14.5% of the Canadian population are seniors. Okay.
Right.
So out of that so there's 4 out of all of the people in Canada, 14.5% are seniors.
Our total
so obviously, the rest of us are not.
Right.
Right. But out of that, seniors account for 44.5% of healthcare dollars. Now, before you go jumping on me, these are just the numbers.
Yeah, because I wanted to, when Valerie first said that to me, I actually said, wait a second. What we also need to address, and part of those numbers addresses this, if you listen careful, is that approximately 45 of your years on the planet are spent barely using the healthcare system that you're paying for.
Right. So as you pointed out to me, seniors have contributed more in tax dollars to healthcare over their years of working, although not utilizing healthcare till much later in life. So basically what we're saying is when we're younger, we're healthier. We all know this, right? And that as we age, we need more medical help. So for instance, could be blood pressure, could be diabetes, it could be a whole
see how you could take those numbers though and take them the wrong way so quickly?
Well, no, because I mean, when you looked at me like you were shooting daggers when I said, but yes, there's 14.5% of our population are senior citizens. However, they account for 44.5%
of the usage of the medical health
care in this country. Now, so that being said, I can see why that would be really,
people go, but then they forget. And that's why I'm saying, let's make the point that these same people have been paying for that for a long period of time when they didn't need it. Like you may not if you're under that age. Like for instance, my daughter's only in her 20s, right? Right. So my daughter might look at that number and go, oh, well, that shows you. And no, it doesn't. It doesn't show you that they spent 40 of those years working. Right. 40 and 45 of those years, and some of them 50. In actual fact, you contributed over those 40 some odd years. And when you're healthy and not using the service, you're paying for your seniors. Now, back to healthcare. Okay. Because we're talking about healthcare, and then we also got into, there's always this great belief from other countries that Canada is so wonderful because we have we have free healthcare. Well, we want to point out, and we pointed out on other shows, that healthcare isn't exactly free. No. Okay. So we pay a lot in taxes. Right. Number one, but our healthcare spending, right? Yes. When you look at it, it only covers so much. Right.
So as you were pointing out to me earlier today, one of the issues that came up is that, so when you enter the hospital, there's the assumption that the services at the hospital are free.
That's
and
right.
for the most part, they are.
Right.
For the most part.
But
We also found situations where people have been
Well,
asked or forced to pay
big dollars
at the hospital for medication.
Right.
So I know you said that there was somebody within
our family,
extended family that
actually got had a diagnosis of cancer, and they were diagnosed with cancer, and then were given options for treatment, and they chose their treatment. Oh, by the way, this person's still with us.
Yes.
This person chose their treatment and went to the pharmacy with a prescription, dropped it off, and was told she was going to have to take these pills before her treatment. The treatment couldn't happen without these two pills. I don't know what they were, and I'm not going to say I know a whole bunch, but I do know this is fact.
Right.
And when she got to the pharmacy the following day, this is a senior, well into her senior years, got up to the cash register and they asked her for $1,000
for 2 pills
that she had to take in order to have her cancer treatment.
Right.
And she said, I can't afford that. Now, I understand that she has a very loving family, and I'm pretty sure she didn't go with that. As a matter of fact, I know she didn't. But the reality is, there would have been seniors who had to choose between treatment and no treatment.
Well, and that's where, now, could you not qualify?
And how long do you wait to qualify for the treatment?
Right, but could you not qualify? Like, I know if you make under a certain amount, you qualify for more benefits through, and that's provincial people.
And yes, that's partially, and in the province that I live in, there's actually more benefits for seniors than the other provinces in Canada. I won't say all of them, but quite a few other provinces in Canada. You get quite a bit more being a senior here, like more.
Right, and the thing is, so much has changed. Okay, right. So it used to be, you know, you had a job, you had benefits, right? And when you retired, you could keep your medical, dental benefits into your senior years, and your spouse even got to keep the benefit card even after you passed away. And they've done away with all of that. All of the new pension plans and agreements out there now, they don't have that. I mean, maybe the armed forces, I'm not sure, but I know within provincial governments and that they don't have that anymore. And
it's scary because we have, I believe that, first of all, for instance, we'll just say eyewear, glasses. Okay.
Right.
Most young people that weren't born with an eye problem don't start gaining eye issues until you age.
Right. You know.
So
start doing this.
Yeah. So I don't understand
why it has to be so expensive to get. Well, and here's the kicker, because even on your private insurance, people. And I've had some good plans. My husband has some excellent plans. Even on your private insurance, I mean, $150 to $250 for a pair of glasses, when a decent pair of glasses, especially when you get into the bifocals and the multifocals, I mean,
just
it was $900 for a pair of glasses.
Mine was $735.
And you get, look, we tried, we were sick and tired of paying like $1,000 or whatever. And we had insurance and they covered about 500 of it between both of us. But then we would have to pay the other 500 ourselves. But the reality is so we thought, well, why don't we go cheaper? And we'll go to Costco or something like that, right? And that way we could get a pair of glasses and a pair of prescription sunglasses. So we did that, but you get what you pay for, because these glasses are not, even though I got protective coating and everything, they're just not having the wear that I still have my $900 glasses.
You're right. They don't.
They just, they're not in style anymore.
Right.
Though I would argue these aren't either.
I'm just laughing, but here we go. There's another thing. Dental.
Oh,
why is that
speaking of which,
or hearing aids?
Oh my God!
Don't you
come
want people to hear
on.
you, and they want to hear me? Like,
you know,
$2,000,
$4,000, $6,000 $6,000 for a hearing aid and more, and private insurance and even your extended insurance doesn't come close to covering costs there.
No,
it's
especially since there's some maintenance and all that to go with it as well.
We're just reading our comments, and you're right. That's the point we were making.
Yeah.
You work 45, 50 years before you retire, right?
You can't even go get your eyes checked and a pair of glasses once a year free.
No.
Out of all those taxes that you never used.
Right. Even if you could, our mother
40 years.
Our mother's always had glasses.
Yes.
Yeah. So,
but I mean, she's always had to get those glasses.
Exactly.
Wasn't like they came. She had to pay for it.
It's just in your senior years. It's my opinion, and because we're getting there, that's the time you can least afford
to get the
when you're raising
the most.
Okay, when you're raising your children, money's tight.
Right.
Okay. When your children go off and out on their own, it becomes a little bit easier, not going to lie. But the reality is when you retire, you don't have that additional income you had when you were working. You're on a fixed budget, and those additional costs are costly. And here's the issue and the question. What can be done to better address the needs of senior health care? Okay, so
either better insurance or higher taxes. Something has to happen, because it's not right that we're
living in a province that is creating a two-tiered medical system.
Right. And that's the other thing. People go, that
it's kind of like our issue on the separate schools. Why put your dollars in two baskets? Focus on one, right? Our public healthcare system, our public school system.
It's no different than, and I'm just going to say the words because we're going to have a whole show on this one, is senior warehousing. I don't like the idea of it being privatized, because when it's privatized, it's for profit, meaning somebody has to make a profit.
Right.
And who gives a damn how we make the profit?
Now, and we also seen the different standards depending on what your income levels are when you're going into, like I happen to know.
All you have to do is look at rent.
In Bedford, there's the Berkeley. Right? Now, sure, if you can afford to stay at the Berkeley, you're probably going to have really good service, and but the reality is that most people like us, middle class, most people are not going to have that kind. Are you going to have $3,000 a month to fork out to these people, or $5,000 a month? I mean, you have to.
I was going to say it's not $3,000. So for a person to get a place with assistance or care, I looked into it, can run anywhere between $3,800 to $5,800 for the kind of assisted living care.
Okay.
A month.
Right.
And people say, well, would the government cut? No, you would just, no, the government does not.
And I read stats too that they said, they were saying long-term seniors in long-term care in a hospital is like $800 and something a day. Yeah. Right. For the bed and everything. And then they said for a living facility, it was $185 on average a day. And then for home care, $42 a day. What is that telling you? Most people, and see, I think most people and most seniors want to be in their own home for as long as possible.
Of course they do.
I mean, until they can't look after themselves, I'm assuming, because that would be my wish, and I'm assuming it's the wish of most seniors out there.
Yeah.
So what do we need to do to make that more
accessible?
Yes, for seniors.
Yeah.
To have
It's
that.
a whole lot easier to have somebody come in for home care and to have accessibility issues to like going places or doing things, say buses, that kind of thing. It's a lot cheaper to pay for that kind of stuff,
right,
in the long run, than to pay $800 a day for anyone to live in a hospital where it's not even uplifting.
Well, and the thing is that there has to, look, I'm the first person to say, why reinvent the wheel?
Right.
Okay. There are other countries out there that are doing better than we are when it comes to seniors and senior health care. And
don't get me wrong, there's plenty of countries doing a lot worse. But most of them are actually down in third world countries.
Okay, that's not funny.
But
it's not funny. That's the sad part. This isn't funny. Because I think the reason why we're kind of passionate about it is because we have parents that are there.
Yes. And we're going
to be there.
And I know my kids never want to admit this, but someday you're going to be there.
Right.
And I'm hoping that maybe
you're going to be us.
Yes. Yes.
Yeah.
Cheers to that.
Yeah.
You're going to be us.
Have fun. Because it is a blast being in your 50s.
It is.
It's like we had a chat today with Will Canyon on the phone, and it says that one of the wonderful thing about being 50 in your 50s is that you can do these passionate things and do this kind of stuff because we don't care what people think anymore.
So I have one for you, guys. What do you want to see? What is if you're a senior out there, and I know that there's at least one out there.
Yes.
What would you like to see them do? Because I can't understand why there's not a way that maybe we can't find out what are the biggest needs of most people. What are the
biggest? I guess that's what we want, because how can you focus on having the conversation and repairing things without having an idea of what the true issues are? We already know
prescription costs. And why would a diabetic have to take $5 after being a senior citizen out of his own pocket to pay for anything? Why? Diabetics have to do that.
Right. But do you know what? That's the sad part of reality.
And you know those fancy, the things that people get and their insurance covers at work or whatever? Yeah, senior citizens can't get that without paying for it.
Why? It would make their lives so much easier.
Right.
Like, see, that just doesn't wash with me.
That's what I'm trying to say.
I mean, I look at it this way. If they're willing to cover costs for your regular diabetic testing, which they do.
They only cover partial. Well, yeah, I guess, but some things they don't, like sticks and certain things. Yeah.
Yeah, but But that's what I mean. We need to know. Okay, so prescriptions. Yeah. We've already gone down the road of hearing. We've gone down the road of eyeglasses. What about mobility?
Yeah.
Right?
Yeah.
For people to be mobile.
Yes.
Right?
And that service to have somebody, take you somewhere is kind of nice.
Yes. And I know there are agencies and that out there in the communities and that do this kind of work, which is great, but it's all at a cost.
Right.
Right.
And it's not that the business's fault. I mean, a business is only a business, right?
Absolutely.
They need to do what they need to do to make money. So it's certainly not the business's fault. What I'm saying, though, is after the age of 65, since it is only 14% of the community, yes, then why wouldn't you look at having complete accessibility. They
I
call
think
it
what you
free.
could do is you could reduce costs in some areas, like if we could get senior housing under control would be huge.
Yeah.
Right?
Right.
And you could increase coverage for others.
Right.
For other costs.
Right.
Right? I mean, because it's all balance and checks, people. We all know how this works, right? You get so much tax dollars and they got to make it spread.
Yep.
But there's one more issue I want to bring
But
up.
I want to see where those tax dollars are going.
Well, and
More
that's something.
transparency on that.
Yeah, and exactly. It's like I'm still waiting to see where all this all this.
Yeah, that's the dirty rich.
No, don't mean that.
Okay,
Sorry,
sorry.
people.
Okay.
I'm talking about because it starts with a C. And here goes Valerie, because I just had one of those senior moments, as they call it. Not putting anybody down. It just becomes more frequent.
Yeah.
Anyways, I forget what I was going to say, so we're just going to move
go
on.
on.
I know what I wanted to bring up is we were talking about costs and how about access?
Yes.
Early intervention is always key to anything.
Okay.
So when you have to wait 8 months for an MRI or 9 months for a CAT scan, I'm just using that as an example. Right. I'm saying access as you need it. Right. And the thing is that
but then
for those seniors,
they argue that in order to do that, you need private health care because then it takes the load off of the public, and healthcare is how they spin that. How they spin that is by having private health care. It takes the load off of the public healthcare system.
Right.
In order to provide you with those services, even though those dang machines are right here.
Yeah. Okay. So now that we've left you with all this on senior healthcare in Canada, right. And I will expect that we will keep talking about this as the night goes on our different platforms.
Yeah. What's up, Litches?
What's up, Litches? All
right. What's up?
So first of all, Sheila, you're what's up?
Okay, so last night I decided, because I've been reading a lot on this teaspoon of turmeric. However, I don't know how to properly pronounce that.
I'm sure somebody will tell us.
I will look it up next time. So anyways, I decided to do that for 1 week, and I started last night. I had 1 teaspoon, and I woke up and felt like I had no pain. Weird, strange. I ask you, I don't know. I'm going to take it for 7 days, and I will report again next week. I did do what it said though, and I put a little pepper in with it. Anyways, so whatever. There's mine. You, what's yours?
Mine's a hack. And this is a hack because we're on the seniors thing.
Right.
This is a hack for seniors.
Yeah.
Only for seniors. You young people who have kids at home, do not try this at home. Okay. So this is called the pill bottle. I'll get it.
Okay.
Do you want to hold the pill bottle?
This is called the pill bottle. The pill bottle, as you know, is the pain in the butt for anybody who has arthritis or sore hands. So we're going to take a said pill bottle and show you how, if you don't have children in your home, because again, you have to not have children in your home. You take a knife like this and you pop it down in between. And then you wrap it around and you pull. And you keep doing it until,
just coming back in.
Lo and behold.
Oh, here it is. I see it.
Mm-hmm. So hold on. Lo and behold.
Don't you use your teeth?
I don't have fake teeth. What do you know?
Yeah, but that's how I chip my tooth.
I'd never.
Yeah, she says that now.
I did.
I didn't think I'd chip my tooth either.
All right. Come on.
Okay, it's supposed to be a pill bottle hack that works better than that. Basically, there's 2 caps. You have the one on top of the little one. You pop out the little one. Leave it to Sheila. I think she mangled it. Anyways, you pop out the little one. You throw away the big one,
Oh, it's
and you can just tighten it on and
I
off.
think I was going wrong.
You were doing it wrong, weren't you?
No, I think I just didn't do it hard enough. There. Hold on. Keep going. You talk.
Okay, so
You talk,
anyways, well,
You
anyways,
talk. I pop.
I've done it a couple of times. Oh, there it is. So there's the little pillow, the little cap. You just put it on, tighten it. Oh, and guess what? You don't have to push down or anything. You just unscrew it and tighten it. And you don't have to worry about this giant
Lid
pain in the neck.
that makes you go.
Yeah, the trying to twist
to
it
do
up. So that, what's up, Litches?
What's up, Litches?
Is our pill bottle hack for you seniors out there.
Yeah, and I will talk to you about the turmeric next week.
Right.
Hopefully.
Right. I'm just, yeah, I think
We'll see how I feel.
see. Yeah, we'll see.
You ready?
Have a good night, everybody.
I hope we gave you something
to chew on.
Have a great night. Lots of love. Mwah.
Bye.
Bye.